TMD treatments. TMD is considered what we call temporomandibular disorder. Most patients will come to my office and say, I have a TMJ. Well, yeah, you do. You got one on the left, one on the right. It's called your joint. And the expertise in this field has changed over 20 years. I've been doing TMD treatments for 20 years. I was a top 10 doc in the Phoenix magazine. I was the only dentist in Phoenix magazine that was allowed to be in the medical journal, which was very, very cool. What is causing TMD? TMD is let's keep it real simple. Your jaw, it needs to be in a good position for your skull. As your teeth are erupting as a youngster, sometimes the teeth don't erupt in a pattern where it makes your jaw happy. So now your teeth want to be in one position, your jaw wants to be in another position. So what do you think is going to happen? Your jaw is surrounded by a bunch of muscles that are now in a different position where it doesn't want to be. It will eventually, over the course of life, grind you into the position. So anybody that's watching this video that is a grinder, that gets discomfort from grinding their teeth down, you are a TMD patient. There are medical signs and dental signs. We have grinders, obstructive sleep apnea patients have an overclosed jaw, profiles that are collapsed, popping and clicking, mild facial pain. So you have a lot of combination of medical and dental symptoms. TMD is not a trained field in dental school, but it's very easily treated. We don't do surgeries like we used to 20 years ago. Basically what we do is an approach called neuromuscular dentistry or GI dentistry, where we tend your muscles, we relax them, we find and do EMG readings on your muscles. This is non-surgical, this is very easy for the doctor to perform. We tend you for about an hour and a half to relax your muscles, and we find a position where all your muscles on EMGs are in a really nice, balanced, healthy, happy state, so to speak. At that point, we look at where the jaw position is, and we make you orthotics that you can remove in down your mouth that will help your jaw position there. We have the patient wear that for 24 hours a day, and it's very amazing to see that the patient's symptoms decrease and go away. And eventually, your jaw is opening and closing in a correct way. People's opening position is a healthy position. Most people do not walk around town with their teeth completely together. It's usually lick your lips and let your jaw hang. You're walking around with your teeth just hanging, right? Your jaw hanging. That's a healthy position. So what causes the problem is the closing position. When you're trying to close your jaw back together and it hurts and you see some shifting within the jaw. And that's what is the unhealthy position, is your closed position. So we even get clients here that just got out of braces that the teeth arranged look nice, but the patient's still having a hard time closing. That's because the jaw is not in a happy place. So TMD is a very, very underserved area, but it's also a very needed area, because any reconstruction that we do when we're rebuilding an entire mouth, we have to know where this jaw position is so our reconstructions can come up that much more optimally. So the candidates that need to consider looking for a TMD evaluation is, if you're a candidate that you're at home and you've noticed your teeth are grinding down to nothing, you go to your general dentist and your teeth are real short, but he says here's a night guard, you may want to have a consult, because you're going to eventually grind your teeth away. If you're having you're losing your teeth for any reason and you're going to seek for full mouth solutions, you probably want to make sure that the doctor positions that jaw or has training in TMD so you have a comfortable position before you spend all the money for the expensive prosthetics that a full mouth reconstruction requires. If you're a patient that has perfect virgin teeth and your teeth are really healthy, but you're experiencing mild facial headaches, mild facial pain, popping and clicking, or you're noticing you're grinding and you want evaluation, you probably should have your joint evaluated.